phone. So, Siravedam, first definition I will just tell, then will explain. Okay? Okay. Siravedam is one of the another important method of Rakthamokshana. Okay? The surgical procedure of puncturing vein before incising skin. Okay? Difference. Prachana means incising skin superficially. This is puncturing a vein for therapeutic purpose. So, surgical procedure of puncturing a vein for what? For a therapeutic purpose. That is the definition.
And you are only puncturing veins. No,
Vein.
why are you not puncturing arteries?
This treatment is called because we need to remove the impure blood. Impure blood is passing through veins.
Yes.
Okay, the sira means vein. Okay, vedam means puncture. So you got the name. The name itself telling the puncturing of vein, because we are collecting the impure blood, vitiated impure blood. Arteries is carrying pure blood. I am repeating. So impure blood is carrying through veins. Okay. So this is the definition. So you need to remember the difference. Prachana, incising not the veins, incising skin superficially for bloodletting. This is surgical procedure or it's puncturing of vein for therapeutic purpose. So both is with sharp needles. Okay, this is little more sharp. So this will be going to little more deeper to veins. That is very small needle. So just superficial incisions. Okay. One more thing, that definition. After suitable preparation of patient. Not in every patient we can't do this. We need to prepare well the patient before doing this therapeutic purpose. So if I am just with an answer, if I am puncturing your vein, that is not venous puncture, that is accidental. Okay, that is just accident. After making that patient suitable for the therapeutic purpose with all the pre-procedures, if I am doing the puncture to vein is venous puncture. Otherwise that is accident. Okay.
Then you are not hema, then you are himsa.
Okay. Okay. You got it? So, Rakthamokshana by method of Siravedam is preferred in physically strong as well as courageous people. That is the second. Prachana, comparing to this, less pain because it's like an ant bite kind of pain with all this superficial. This is little bit like an injection. Okay, but lot of vein is lot of blood is releasing. The patient should be that much strong and also courageous because they are seeing. Okay, like about 150, otherwise like 200 ml of blood is collecting at a section every week. Otherwise, whenever we are planning the treatment, we are releasing like about 200 ml of blood from a patient. So that patient should be in an anemia patient. We can't do it because they are already having less blood. So that patient should be very strong and courageous. So
This is less pain?
less pain. No, more pain.
This is more pain?
Yeah. Not in the sense pain. Pain always when we pricking it's the pain. But that pain will be like ant biting for that. This is painful while injecting the needle, but releasing of blood make them irritating. Okay, that courageous should be there. So suitable preparation, one thing, patient should be very strong. That we can't prepare the patient in which they should be very strong, otherwise they need to be aware about the procedure and they should be very courageous for doing this procedure. And again the importance of this treatment, as I said, the beginning, I think in Rakthamokshana introduction class I said, tell in general medicine Basti is considered as the half chikitsa. Okay, in Shalya Tantra means in surgery we are considering Rakthamokshana as half chikitsa. Among Rakthamokshana, Siraveda. That is the important. So this is the important among Rakthamokshana. So we studied many Rakthamokshana: Jaluga, Sringa, Alabu, Kadiyandram, Prachanam and Siraveda. So this is the most important among Rakthamokshana. So this is in surgery in the sense Ayurveda surgery. Okay, Ayurveda surgery. Subject called Shalya Tantra. That is Ayurveda surgery. Siraveda means half equal to all other treatments. Okay, this word you were confused on that day. What means by half equal? Okay.
No, I'm not.
So that just think, if you are very strong person, okay, inbuilt, if you are very with lot of muscle, if you are very strong, if you are very like Michael, if you are very strong, okay.
I'm very strong.
If I am very thin, very weak. If she is very thin, if she is very weak, we will compare you when we are together. For us, you are equal. So like the same, Siraveda is equal to all other treatments. If you have the strength of 3 together, so you are considered as the half, and we all in one side is equal to you.
Like balance.
Yeah, but then only it balance. So like that, this is like a half of in the Ayurveda surgery. If took all the treatments in one side, Siraveda is considered as the half treatment, because Siraveda is removing the toxins which is spreading through the blood. So in all over the body where having vitiated blood, we can remove through, because Rakthamokshana like Jaluga and everything is for deep seated, and Prachanam is for one localized. So if we done that treatment, it is removing the vitiated blood from that area only. But if we are doing Siraveda, it is removing the vitiated blood from the whole vein. Okay, so the vitiated blood will not circulate all over the body. So the vitiated blood will not create diseases in any of the body part. Okay, not in one area. Okay, that's why this treatment is considered as half treatment.
So for the past treatment, that it was only breaking, vitiated blood will continue flowing to the same area, no?
Vitiated blood is taken from that area.
But if it's not eliminated from the entire system, then more vitiated blood will reach to that area, no?
The patient's condition, like in all diseases, we are not planning. This is planning for that kind of condition who is having vitiated blood all over the body, like in
but
eczemas.
I am asking for the previous treatment, it was localized.
Localized vitiated blood.
Yeah. So you are withdrawing the localized vitiated blood from this.
Yeah.
But then if it's keep on running, then it will collect again the vitiated blood.
We will prick and release the vitiated blood from that area.
There is no vitiated blood in the whole body.
Yeah.
It's only in this
In
area. The whole body is no vitiated blood. So if you
That's why
release
we
it,
plan
it's
Prachana.
finished.
If it is in a one body part, we will plan Prachana. If it is running or vitiated blood is all over the body, the symptoms is like that, then we will do Siraveda.
But how does the vitiated blood accumulate only in one area?
How?
Yes, how?
It is accumulated, that's why it created some kind of symptoms in one area. That is just anatomy or physiology. If it is like like in normal concept, if there is good and bad pupils all over, okay, if we have like in mixed, okay, if there is bad students in a class, okay, in one class, the option to remove them from that area,
I think we just don't.
okay,
need
but
to
if
know.
there is bad and good pupils
Understand.
mixed, so only way to make the bad people good only, okay. So if it is accumulated like that, we will do prachana. So this the symptoms of vitiated blood will be, so it is not like how it will be localized in one area. If it is accumulated in one area, the symptoms in one area, okay. If it is spreading, the symptoms in all over the body, okay. Otherwise, if your vitiated blood is not accumulated in one area, you will not have that hair loss issue, like not hair loss, one area issue, okay. Otherwise, if your body is having vitiated blood, you will be having all body skin diseases. Otherwise, lack of circulation all over the body, showing symptoms like numbness, that kind of symptoms. Otherwise, like not vitiligo, this lack of circulation will create white patches all over the body. Psoriasis all over the body means that is spreading. But if it is psoriasis, like scalp psoriasis, we can do prachana.
But it's in the whole body, then it's like
Better Siddhaveda.
Siddhaveda.
Better Siddhaveda. So that is up to the patient's symptoms. It's not like how we can't tell anybody because that is blood. That just reached in one body part. So it will show symptoms over that area. Just listen, Ji. Don't look at phone. Then only you will understand the procedure.
Yeah, I'm already done through this.
So I'm telling that just learn that. It is not like we can't tell how vitiated blood is locating in one area. If it is accumulated in one area, it will start to show symptoms in one area. Okay?
And
Then we'll use prachana. But if the vitiated, we can't tell blood not to flow all over the body. It is flowing. Okay? So then we are seeing the vitiated, dushta rakta rakshana. You studied that also. All these things teachers when they teach dhatu, rakta dhatu. When the blood having some normal properties, when it is get vitiated, it will show some other properties.
Yes.
So when it is showing in one local region, we will do prachana. Otherwise jaluga or anything. Otherwise, if it is flowing, it will be showing some symptoms all over the body. Okay. So at that time, the only way to remove. At that time, if I am thinking you having eczema because of vitiated blood. If I am noticing in one area, I will plan about jaluga. Then I am noticing the eczematic lesions all over the body. So I need to know, so need to remove the vitiated blood from your body. The only option to remove the whole body vitiated blood is Siddhaveda. So at that time I will plan like that. The blood will flow according to their own wish. Okay? You can't say you can't say any bird person to sit one side. If it is sitting one side, if they are making sound over that area, we need to clean that side. If they are running, we need to clean that.
It's okay. It's okay.
No, I need to, because that's why we are teaching. Then after the class, if you are saying you didn't understand, that makes.
But that was not even my question. So you just spoke for 5 minutes
No.
about something.
What was your
that
question?
It
Why
doesn't,
it is accumulating in one area?
you know, it doesn't matter. It doesn't matter.
It's clear, Ji. We can't say blood to accumulate. It's accumulated. That is body physiology. Then if it is accumulated in one area, we need to treat that. Okay, we are doctors to treat the symptoms. Okay, we can't tell the body or body structures to move like that or anything. If symptoms shown, then we will plan the treatments. Okay. I think that makes sense, right?
We just continue. And
Okay.
see.
Yeah.
Okay, so the indications like the same. If it is a vitiated blood, all our body conditions we will be planning. Generally, we will be planning this treatment for psoriasis, eczema,
Indications. Psoriasis,
I will tell some modern names.
eczema,
Skin conditions such as, okay, skin conditions such as psoriasis, eczema. Then neurological conditions such as not neurological, otherwise locomotor. Okay. Sciatica.
What is sciatica?
Sciatica, because of this nerve compression, okay,
Ah,
there will be
okay.
lack of circulation.
Yeah.
So we will feel numbness, pain to the
Yes,
legs.
yes.
So at that time we will be doing in that area.
Oh, okay.
So it will help to improve the circulation.
You don't use here, you do.
So we can option, we have massages here, we have other local treatments here, but if there is, we are thinking about lack of circulation is creating, so we will remove little bit. We don't
Oh.
need to do like in skin conditions.
Oh,
Okay,
interesting.
we will just improve the circulation with 1 or 2 sections of venous punch. Okay.
Ischias, yeah. Sciatica. Now I know. Ischias in Italian.
Neurological disease condition.
Like disease?
Food. Numbness in arms. And then some unscientific things I will tell. Common diseases that we will use Siraveda is like skin disease like psoriasis, eczema, venous ulcer, like in Jaluga Vijarna. Okay, if it is in one area but very deep, Jaluga, leech therapy is the better. But if we are feeling like venous ulcer in many body part or psoriasis is like spreading,
Okay.
we need to clean the blood. That is the only option. Just write that, but then I will tell you.
CS stands for?
Huh?
CS? SSC?
Sciatica.
Neurological?
Neurological system.
Oh.
Otherwise, locomotor condition.
And to this tooth disease.
Tooth disease. So many conditions is there. This is not the only solution, but for all conditions in practice we are not using. Okay, according to Ayurveda, according to Acharyas, they are telling for like thyroid,
Oh.
they will use it. Okay, for liver conditions. Okay, so liver condition, spleen condition, because vitiated blood is circulating.
Okay.
So at that time they will be doing in some rare cases, but as practice we are not doing. So that's why I didn't tell. Otherwise you will be getting confused. In ancient texts they are mentioning in liver conditions, splenic disorders, spleen disorders, or many other conditions. Okay. In practice we are using all these conditions. So if there is swelling in knees means there is lack of circulation and inflammation is there. So at that time the swelling will be there.
Yes.
If there is proper circulation, we can move the area. So without movement, the inflammation will localize the, will be like very much like in Ayurveda, we will call, it's like a head of, like Kurkand English and head of fox. That kind of swelling will be there in the knee. So at that time, we need to remove the inflammation. For that, we need to improve the circulation.
Yes.
So while that, for that we will do here. For sciatica, there is no proper circulation to the foot, leg. So at that time we will be doing in this foreleg. Okay, and if there is numbness in foot, numbness in palm. So if there is numbness in palm, there will be no proper circulation. So we will be doing in this kind of ways. Otherwise, if there is no proper circulation, numbness means because of lack of circulation, we will feel that numbness. You right?
Numbness,
Yeah.
yes.
So because of lack of circulation, we can't move very easily. We will feel like not shivering, we will feel like lack of sensation. So that is because of lack of circulation. Okay, so we will take the blood. So then if we remove the vitiated blood, there will be normal proper flow of circulation will be there. Otherwise, in vitiated blood, some clots kind of things will be obstructing the normal blood flow. So if we remove that vitiations, then normal proper circulation will be happening. This numbness kind of symptoms will reduce.
And then also like if the circulation is proper, kapha and pitta will go down.
So through vitiated dosha itself, it will be releasing out. Okay, like in pitta is not in a visible form. It's not like a thing. But if whenever the recta is vitiated blood is releasing, the vitiated pitta will also release. Otherwise, in the terms, it's not like visible thing, but the concept like inflammations, the aggravated doshas will release. And also you need to think, for all the numbness in food, this is not the first solution. For the numbness in the foot or the sciatic and everything, we have different options. Like treatments is there, external treatments we will do. If all those things is not working, only we will be planning this kind of surgical procedures. Because we have many options, then to remove that kind of aggravated, these blockages will be because of aggravated bada. So at that time we will be doing vasti. Otherwise, just for this kind of numbness, we will be apply, just for improving circulation, we can apply oil massages. Then even after oil massages, the numbness is still persisting, means there is lack of blood lack of blood supply. So at that time we need to remove the vitiated blood. Then the proper blood supply all over the body will be happening, symptoms will reduce. So this is the concept we need to know. Then if there is no other options, then we will think about surgery. That is even in allopathy also. They will not plan for, even in a organ condition, for all the organ diseases, they will be giving some internal medicines. If it is not cured with all the medicines or if with the small treatment, then only they will plan for a surgery. So surgery kind of things is final decision. Okay, if no other treatment is working, at that time we will plan about the surgical procedures. And for all these things also, like example, that you don't need to know, but you just need to know about the procedure. Doctors will decide where to do. So like an example, if it is like padaharsham, numbness in foot and everything, we will be doing the Siravedam 2 angula above the Shipra marma. So marmas, you will get the marma class also. So doctor teaches few of the marmas, like so you in the next classes you will get more. So Shipra marmam is a marmam in the hands. Okay, so if there is numbness in the hands, we will be doing 2 angula, that is a measurement, like centimeters or meters, like a measurement. 2 angulas from there we will be doing the Siravedam. So for doing Siravedam, I will tell about the procedures. We need to tie, like 5 centimeters above we need to tie it, then blood need to be collected, then we will do the puncture. Then only the blood release will be there. Okay, like normal blood test also. If we need to do the blood test, if they need to inject here, they will be tying here. Then blood supply will be more here, then blood release will be there. Otherwise, it will be painful. Otherwise they need to puncture the vein and squeeze it. So to avoid that situation, they are tying very tightly. So there is much supply will be there. So like the same way we will do the Siravedam also. So for all this treatment, we will do Siravedam in different locations. Okay, so for this kind of numbness of palms, we will be doing here in these veins. Okay, for numbness in the foot, we will be doing 2 angula above the angle joint. This is malleolus.
And for example, for the knee, this whole
So at that time we will tie it here and we'll be doing it in the popliteal vein. Okay, so according to symptoms, we will do the procedure. And some like in varicose veins. So one thing I forgot here, varicose veins. Okay. So varicose veins, you see the veins, right?
Yeah.
So if it is a leg, okay. If it is a leg, the veins, normal vein will be like this. Okay. If it is a varicose veins means because of some pressure, the protrusion in the veins will be there. So the vein will be starting like this. Okay. So at that time we can see like blackish protrusions. So it means blackish color veins, means impure blood vitiation is there. So at that time we will be doing venous puncture over that.
Also chalupa possible?
Jaluga is possible, but Jaluga, as I said yesterday, it's not, it will doing it in the capillaries. If they bite it in the puncture, like if they bite it in the veins, that is venous puncture. That is not Jaluga Vajana. Because vein is like through the vein, impure blood is passing with high pressure.
Yeah.
Okay, so and after is the blood flow is very slow. So that's why suiciding.
Yeah.
If there is vein cutting, the blood stream will be with very like large stream of blood will release and with high pressure. So Jaluga, we need a like slowly they will suck the blood. If they puncture or if they suck it in the veins, it will be like the venous puncture. The blood will be flow like this.
Yes.
So that's why we will not do the Jaluga Vajanam in veins, in the capillaries. If it is like in the smaller, in the veins also in the smaller capillaries we will be doing. Otherwise, if it is like a vein, if they bite or if we prick with a small pin itself, the blood will be flow like this. Because with high pressure blood is passing. Okay. So, and in different conditions, like in sciatica, 4 angula below or above janus only. So, for sciatica, because of nerve compression, there is nerve compression, so lack of blood supply through the veins, otherwise through the capillaries here. So, at that time, this is janus only, knee. 4 angulas above or 4 angulas below, we will do the venous puncture. So, if we are doing it here, above 5 cm, we will tie it very tightly. Otherwise, if you are doing it here, above the position from that area where we are doing the venous puncture, above 5 cm, we will tie it very tightly. So, we will be able, so the vein will be more visible. So, we can prick it very easily. Just for more visibility, we are tightening the area. So, at that time, vein will be more visible and also the blood supply to that area will be more. So at that time, because we can't wait it for like 1 hour procedure or anything. Like within 20 minutes or something, that much blood will be flowing. We will collect maximum 100 ml. More than that, if we collected, the patient will start fainting. That also up to patient's strength. We will
maximally 100.
No. Minimum 100 ml, then 150 to 200 ml. That is the normally collection
At once.
at one section. Okay, so that also I will tell. According to the patient's strength, it will be different.
Similar to use the similar to drawing the blood from vein.
Scenario
Like if you
from the hospital for blood donation. Syringe.
Yeah.
For syringe, they will just take for blood test or something. They will just take 10 ml or something, 10 ml or something only. This we are removing the vitiated blood. So maximum, this is little more.
And then if I use syringe to vision blood place, this area, is that the same effect? No, because it will be too little. Usually more vitiated blood than 5 millimeters or 10
Syringe will be like 10 ml or 20
You
ml.
can use many syringes.
That's also up to the lab test. If you are doing it for a lab test, if we just need few blood tests like CA, CBC, complete blood count, ESR and everything, they can take all this just from 10 ml blood, because they just take a drops. Okay, they just take a sample for all this. Then if they need to do some other blood test, okay, like RA, ANA, they maybe need little more. So at that time, for according to the patient's need only, not blood test only, they will take accordingly. If they have like little other procedure for tissue culture or something, some like blood test will be getting results after blood culture. So at that time they will take little more. So generally they will take 5 ml, otherwise 10 ml maximum. According then, generally they will take in a 10 ml syringe. They will be drop into different bottles for different purpose. Maybe one for just sampling, just for one for some tissue culture. So like that. Okay, that's up to the test only. For every condition, they don't need that much blood. Okay. Then like in every condition. So then this one, tongue and tooth. This I didn't done, but in text they are saying, like in ancient text Ajay has mentioned, for many tooth conditions, tongue condition, they will be doing in the veins under the tongue. Okay, like this. Then they will take that, because I didn't know the practical possibility, but there is nobody will
because
come at
this
it.
is a very local disease. So why not doing then prachana for the open disease?
We, like in a tongue, we can't do that kind of pricking too much time because
It's sensitive for
Yes.
my tongue.
yeah, so tongue is very sensitive. So if we prick, we can collect little bit vein, then we need to heal it. That's the procedure. So in some conditions, okay, and also tongue, because of the vitiated blood is running the veins and creating many other diseases.
No.
Prachana is for only like one, not one symptom, one local region condition we will planning prachana. If some diseases is there because of the impure blood through the nerves passing, like lingual nerves passing through the nerves is creating some issue, we will be doing venesection, we will remove the vitiated blood. I did internet, so I can't explain too much more, but these kind of things, it's very effective kind of thing. So the procedure, okay.
How do you know that the neurological problem is related to a blood problem?
No, this is neurological symptoms. This numbness and everything is nerve issue. That also I said now. We have different options like oil massage and everything for all these symptoms. We will do all those things. Then if it is not working only, that is because of the vitiated blood. If we get that idea only, we will plan this treatment. In the first day itself, we are not planning for all these symptoms. Siraveda.
So it's trial and error. You cannot know.
No, this is not the trial and error because this is not the first section. Trial and error will be the superficial treatments like oil massages.
No.
Yeah.
So first you
All
try
the managements,
and if it's
even in
not
allopathy
working,
and even in Ayurveda, all the managements in trial and error because all the body structure is different. So for like kidney stone, we will not plan like kidney stone, you know, right?
Yeah.
So we can do surgery in the first day itself. We will be starting with internal medication by thinking mostly the stone will be passing with the medicines. We will try with that. Then if it is not working only, we will be advising them to do surgeries, otherwise laser or anything. So all the managements is from the minimum complication procedure to the maximum. We will start with the minimum, then if it is not working only, we will go for all the treatments. If we get any patients here for the fever, we will be giving some medicines to treat like a normal symptom. Then if it is not working only, we will be doing blood test. Then if it is in blood test, if there is any like viral or any bacterial infection, then we will go for in the first day itself. If we are thinking about too much complicated chronic symptoms is that we will be doing the blood test. Otherwise, we will start with the common medicines for fever or skin conditions or in skin cough. All the treatment managements for or doctors is planning like that only. Okay. In a skin condition, we will be start with external application. If it is not working, we will be going for internal medication. If it is not working, we will be applying for blood test. Then we will find out the reason. Then if it is vitiated, so if it is too much ESR in blood test, means there is too much infections. So otherwise, if it is too much WBC, means there is too much infection. At that time, we clear this. So nowadays, it's easy to assess whether the blood is vitiated because we have like blood test. In ancient times, it was very because with their knowledge only they are assessing. That is because of the vitiated blood.
So vitiated blood means like having bacteria,
Viral,
virus.
otherwise any other kind of inflammation. The inflammatory signs is ANA, RA, ESR.
Yes.
So all those kind of things. So eosinophils. When we have allergy, the ESR level will be more. Means infection is more. So at that time, if it is getting very vitiated, so nowadays it's very easy to assess it is vitiated blood condition. That's the thing. And for this prachanam and everything also, we will be giving, sometimes we will be taking little bit sample. Then we'll send to lab for blood culture. Then if we are thinking there is lot of infections in that area, we need to remove that vitiated blood. So now we are teaching as per Ayurveda. We are not doing any, and like in ancient times they are not doing the lab test. Nowadays we have many practical possibility to assess whether it is vitiated blood. So as I said, the trichology or cosmetic clinic. Okay, if there is any skin condition like acne, we will be starting with any external applications like creams, ointments. Otherwise we will give internal medicines. And even if after that, if it is not working, we will be giving the blood samples Otherwise, like pap smear, like sample test, will go and will after culture we will be saying okay, it's some because of some infection. So we will be planning treatments accordingly. Then procedure. Procedure the same. Purva karma. Pre-procedure. Like the same, like in before, we need to prepare the patient first. The collecting things is the second. So collecting things means the same. Instead of lancet, here we needed large needles, like injection needles. Okay. So first one, preparation of the patient mentally and physically for the procedure. Okay, then again the cotton goes everything. For all the Rakthamokshana procedures, the same requirements. Then after bleeding, we need to apply the medicated ghee like Jatiyadigrudam, which is good for healing. Okay.
Afterwards.
Yeah, afterwards. Then, if it is Adiyoga, to less bleeding, we need to use the Rakta Stambhaka herbs. Then, if it is less bleeding, Hina Yoga, we need to make the blood bleed. So, Rakta Pravartaka herbs. The same that I studied earlier. I am not going to explain that. The same, okay, same things. The herbs that you use to stop bleeding if it is too much bleeding. The herbs that promote bleeding if it is less bleeding. Okay, can I raise it? Then procedure. Procedure. As we need to do this in a courageous patient. Okay, so first I will read. Then you will get an idea. Then you can write later. Okay. The physician should ask the patient to perform all the auspicious ceremony in that day. Okay. If they want all the auspicious ceremony, after that, after determining the strength of the disease. Okay, if it is very severe chronic venous ulcer, varicose vein, otherwise if it is a less not chronic, very acute varicose, we need to assess the strength of the disease as well as strength of the patient. Doctors will plan and they shall everything, the patient's disease and the location of the area to be done. The physician should give him either. So after assessing all those things, we will be calling them for treatment. We will inform them to ready for the treatment. We will be giving little bit mamsarasam. Mamsarasam what means?
Muscle?
Mamsarasam.
Rasam?
Rasam.
Muscle to drink?
No, meat soup.
Meat soup.
Something like something. Because they need that much strength. Okay? So that's why.
So rasam is soup.
Rasam means like liquid, like extract of anything. Rasam here in our place, rasam is a dish.
Yes.
That you are getting here with pepper, tomato and everything. So that is a like after skewing vegetables, pepper and everything, we will make that liquid.
Okay.
Mamsa rasam means meat soup.
Meat soup.
Otherwise, amamsa rasam means vegetable soup.
Ah.
Okay, like akrita mamsam, amamsam rasam. So otherwise, vegetable soup ni വേറെ പേര് മതിയല്ലോ akrita mamsa rasam. like rasam means something kind of soup. Okay. So then otherwise or yavagu means like kanji, porridge prepared with any snigdha dravyam. Like snigdha dravyam means oily kind of, which gives nourishment. Anyway, mamsarasam or yavagu with snigdha dravyam means some food which give nourishment to that patient. Okay, as a drink before the treatment. After this, the patient should allow to rest comfortably for about a muhurta. So after this, 48 muhurta means 48 minutes. That is a Ayurveda like time measurement. Okay, so 48 minutes. So we just need to assess the patient. Patient assess the strength of the disease. Then food. Mamsarasam or yavagu is a porridge. Yavagu means porridge. Okay, with snigdha dravyam. Snigdha dravyam means oily herbs. Okay, so both for nourishing.
Okay.
Then we'll advise the patient after all this. Take rest for one muhurta, that is a time, means 48 minutes. So this is the procedure starting. Okay.
So the Mamsa Rasa, is it in the morning?
Before
or-
doing the procedure, whenever we are doing the procedure.
And the procedure, is
See-
it in the morning or evening or doesn't
No,
matter?
whenever we are doing the procedure, so 1 hour before that. So
Okay.
we will be giving the food, then we'll advise the patient to wait for 45 minutes, rest.
He wants to know if there is a time for the procedure.
No,
Early in the
whenever- no.
morning or in the
1 hour
afternoon?
before the procedure. If we are doing the procedure in the morning, 1 hour before that. If the procedure, so that procedure will also, we are doing this to release the blood. So the blood we need to get maximum. So this procedure having particular time in every season is different. Okay. So according to the procedure time, we need to give the food. Okay. So whenever we given the food, 48 minutes they will take rest, will come for the treatment. Okay. You got it, right? So the time of administration of this procedure, generally as we discussed, Rakta and Pitta is correlated, right? So the Pitta dosha get aggravated in which season?
The pitta in summer.
Pitta? Pitta വാദം മഴക്കാലത്ത് റെയിനി സീസണിൽ വാദമാണ് അഗ്രവേറ്റ് ചെയ്യുക. Pitta is aggravated in summer and also in autumn, like in chayam, pragobam, prashamam. Okay, chayam means that dosham will get accumulated. Pragobam means it get aggravated, like vitiated.
Okay.
Then prashamam means like
Reduce.
subside. So it will normally we will be doing this procedure. We will be doing this procedure in Sharat Ritu. So all Rakthamokshana, before also Jaluga Vijanam we also said Sharat Ritu is the ideal time for doing this procedure.
Which season? was
Sharat,
it? Yes.
autumn.
Autumn.
The after the summer, before starting the rainy season. That is the in between time. Actually here there is no particular autumn season. Autumn and spring is not there. Here we only have 4 seasons. So like in general there is 6 seasons. According to our according to our environmental season alla according to our geography we only have 4 seasons, but we will considered in between summer and rainy season is the autumn.
Yeah.
Okay, but in different, like according to other geography there is 6 seasons. So generally we will be doing this in autumn season, where the pitta can aggravate too much. So that is Sharat Ritu.
Okay.
Otherwise
So
it is
the
aggravated in Grishma Ritu. So that is in Grishma Ritu. But at that time what will be happen? That is in its peak form. So when at that time if we done this treatment, if the bleeding start, we can't stop it. Okay, like in summer season, otherwise in mid-noon time, if we cut our finger or anything, the more bleeding will be happening. So that's why we are avoiding the Grishma Ritu. We'll be doing this procedure in Sharat Ritu, in between. So autumn season is the time.
I think autumn because in the summer you are accurating,
Not
Pita,
time,
Pita, Pita. And
season.
in the autumn it's at its peak.
All the
because in the
Rakthamokshana.
summer you are
All the
collecting
Rakthamokshana
Pita.
is good to do in Sharat Ritu. But we have exceptions because if we get patients in any other season, we need to do. But according to some changes will be there. Okay.
Sharat Ritu is autumn.
Autumn. Grishma Ritu is summer.
We can revise on Sunday the video about the
you need
seasons.
because all these things sometimes we are not getting also because we are telling about the concept.
Yeah.
All this dhatu, artery, veins and everything is like rasam and the nourishment things and everything is in the previous classes.
Yeah.
Like in the online classes, all the basics we then we are now we are teaching this. So
Yes.
in basic idea, if you learn all those things, you will get an idea. Because like the same we studied in our college. All these things we studied in our final year. Before that we studied all the things that we took in online classes in our first year, second year and third year. Then if we are studying these concepts in the final year, we know about the seasons, we know about the doshas, dhadus, vitiation signs, where the doshas will vitiate. So that's the thing. So if you have an understanding about the dosha, seasons and everything, definitely when we teach this, you can, okay, definitely it will be doing in Sharat Ritu. Otherwise if you are doing it in a rainy season, at what time we can do this. So all those concepts you will get an idea. So just go through that. Okay. So normally Rakthamokshana will be carried out in Sharat Ritu because of the vitiated pitta will be there. But it's not too much vitiated like in Grishma Ritu. So we will have a moderate release. Okay, we can stop it. If something happened also, we can reduce the complications. Okay, then Sushruta has further specified that bloodletting should not be performed on a patient in extremely hot or cold weather. So that's why we are not doing it Grishma Ritu. Grishma Ritu is the season, it's summer.
Yeah.
But too hot.
Too hot for you.
And not in too cold, because if we done this in cold season, if there is vein puncture, bleeding will not be happen. Okay, Sushruta told, don't do this in too hot or too cold. So
like fasting.
Grishma Ritu and too cold means Hemanta Ritu. Hemandam or Shishira. Because if we done this in Grishma Ritu, in summer season with too hot, if we pluck it, if bleeding happen, too much bleeding will be there. That is happening in a day. If you are taking a day, if there is a wound happening in daytime or in the night time, bleeding we can stop. But if the wound is happening in the mid-noon time, lunch time or something, there will be a lot of bleeding. Because of that, the pitta is more in a day, pitta is more in the mid-noon time.
Yes.
Okay, so in the climate, pitta is more in a Grishma Ritu. So over those, when pitta is too aggravated or if the heat is too much, if we done this procedure, lot of complications like overbleeding, like adiyogam will be happening. Okay, so generally we will be, so Sushruta has tell not do in extremely hot or cold. So if we done it in cold season, what will be happen?
Less bleeding.
Yeah,
Hema yoga.
the Hina yoga. Okay, if we done it in Grishma Ritu, Adi yoga. Okay, then neither in 1-2 is not too much heated or improperly heated. Okay, so before doing this procedure also, like in Prachana, we can do a local oil massage and local steam. So if there is too much fomentation be given, if the body part is too hot while pricking, there will be a chance of getting too much bleeding. Adi yoga. So moderate temperature steaming only we can do.
Also in
Like it's not
Shira.
necessary. It's not necessary for a, like if we are not getting the veins, if there is no proper circulation, we can do it. But if we are doing, there shouldn't be too much heat. If we are doing that, okay, for vein generally if you are doing it in a vein will be more visible.
I can see my vein.
Yeah,
So
vein is
no
more
steam.
visible. Yeah,
No steam.
no steam. But if it is less visible, if there is no proper circulation, if we are feeling like the blood is like clotted.
Yeah.
If we done the steam, it's easy to release. So
Easy to see the vein.
it is easy to like, otherwise the blood will be like clot. It will be
Okay.
slowly released. So otherwise, if we done steam, it will be easily flow.
Okay.
But the heat shouldn't be moderate. Should be moderate. Okay. സമയം എത്രയും 10 minute ഉള്ളൂ. Okay. Then in addition, so the climate should be Sharat Ritu, not in Grishma Ritu or nor in cold season. Okay. Then in addition to the above season, if we get the patient in some other climates, okay, what are the other climates other than Sharat Ritu? We already mentioned. Yeah. So Varsha Ritu is there, Vasanta Ritu is there. Okay. So if you are getting patients in other season also, we need to know at what time we will do. Okay. So if you are getting patient in rainy season, okay, when the sky is clear and devoid of clouds, means that is like there is not that much Kaba or Vada, but Pitta is there. So at that time we can do. Okay. So in all climate we have some exceptions.
Wow.
Rainy season without clouds,
Sunday is cloud.
devoid of clouds. Devoid of clouds. So in rainy, so other than this season, in rainy season,
Like today.
like today, when sky is clear and devoid of clouds. Understand? So in every climate I am telling at what time we can do this treatment. Okay. Then other season, in summer season. Okay. In summer season we avoid just because of more heat. Okay. So but if we get any patient in summer season, the cool time, whenever is comparatively
Morning or evening.
morning or evening, not in lunchtime. Otherwise, if there is too much heat, comparatively more heat in the evening, we will be doing it in the morning. Otherwise, early morning or late evenings. That is the ideal time. So
Or night.
no, night we are not doing because we need to see the waves. That's why. If we have OT, we can do it because the comparatively the temperature will be less. So if you are doing it in summer season, the cooler time. Okay. That is like basic concept. In need blood release, but it shouldn't be too much or less. So at that time, in all climate, we will decide the time accordingly. So that's why I didn't told the time for eating mamsarasa. In each climate, whenever we are planning the treatment, 1 hour before we will be giving the soup, then 8 minutes of rest, then we will call them for treatment. So there is no time like we need to give mamsarasam in morning. If we are doing it in evening, there is no result by giving this mamsarasam in the morning.
Okay.
If we are planning that treatment in the evening 4 o'clock, we will give it at 3 o'clock.
Yes.
Then advise them to wait for 48 minutes, then they will come for treatment. That is the basic concept. You all got it, right?
Yeah.
Then Hemanta Ritu. What is Hemanta Ritu? What is Hemanta Ritu?
Summer?
No, summer we wrote.
Oh, sorry.
That is Grishma Ritu.
I don't-
Another thing,
Spring.
winter.
Winter.
Okay? Because here we told don't do it in summer and in winter.
So which seasons do you have? Like you have,
Generally we will do it in Sharat Ritu.
yeah, but generally you have spring,
What are the seasons?
spring, summer,
Okay.
autumn, winter,
Then little more.
and rain season.
Then one more.
One more.
So summer Grishma Ritu. Okay. And after that, before starting rain, that is autumn season is Sharat Ritu.
Okay.
Then rainy season is Varsha Ritu.
Okay.
Okay. then spring season.
After rain comes spring.
No, before that, here we don't have that seasons, autumn and spring we don't have. We only have winter, summer, rainy season, and then one more thing in between time. കുറച്ച് winter ഉള്ള time അല്ലേ? ശിശിര ഋതു. Shishira Ritu with not too much cold. Like October, November, December and January. All this season is like winter here. So too much like snow kind of winter is there. Less winter is there. Then very much summer. That is Grishma Ritu, and Varsha Ritu is rainy. In between time is autumn. Yeah, autumn is there and then spring is there. So here we said generally we will do it in Sharat Ritu. Generally we will avoid Grishma Ritu and Shishira, like Hemanta Ritu or Shishira, both is like winter, okay? We will avoid. But if we get any patient in this climate, we need a time. So if we are doing this treatment
then we use this.
Rainy season when sky is devoid of clouds. When we are doing this in summer season, it is too heat, so in cooler time. When we are doing this in winter season, okay?
Then
at that time we need little bit heat.
Heater.
So noon time.
Noon is 12. Lunchtime.
Like 12 to 2, otherwise 11 to 2 is the little bit. So in winter time always cold. If we done this treatment, no bleeding will be there. So by lunchtime there will be the aggravating time. So at that time if we done it in winter, nothing will happen. Normal bleeding will be. Swedanam we can do if it is necessary. Otherwise we will try this without Swedanam in the first day. If it is like stagnant blood, if it is very difficulty to release the blood, then in the second section we will start Swedanam. So these are the seasons for doing. Sharat Ritu generally, so Sruda suggests don't do it in Grishma Ritu or Hemanta. But according to other acharyas, if we get patients in rainy season in this climate, in summer season in this climate, and winter season noon time. That's the concept also you got it, right? If it is too heat, cooler time. If it is too winter, the noon time with heat. Okay? Over. Then procedure. Procedure only we need to learn. Procedure പറഞ്ഞിട്ട് ഞാൻ നിങ്ങൾ വിടുന്നു കേട്ടോ. And one more thing, the above side periods are suitable for Rakthamokshana. Okay, these sides, like these climates. Beside this, time factor depend upon the condition of the disease. Okay, and state of the patient during which the surgeon has to take his own decision for Rakthamokshana. All this can be vary according to patient's condition. If the patient is having other symptoms, or if he is not stable at that climate, if we have any other complication, if we done that treatment in that time, we will check all those things, then we will change some plans in some cases. Okay, generally this is the concept, but the decision, final decision of time will be according to doctors. Okay. And if one doctor is thinking in summer season, if we have his management, if overbleeding happen, maybe he will be doing it in other than cooler time if we have any, because in rainy time or winter time, if all the climate is cooler, even in the lunch time it is cooler, he will do it in any of the time. He will have some management for Tina Yoga.
One second, now it's like 5 p.m. I think you want to go, huh?
Yes, I'll go. Like if he doesn't to stay, it's okay, but okay. It's already time for tourists.
Can I continue? Procedure only, okay?
I sent you a picture.
So the procedure, the patient should made to sit comfortably on a stool of the height of, because I didn't start at 4 o'clock, that's why I am continuing. I started at 4:15 only, okay? So 1 hour I need to complete, then only the video, so 1 hour class. Okay, so procedure, we will call the patient to the treatment room in the height of a knee, that is the stool size, like this size. Okay, we will take the patient in that. Now we are just explaining the common procedures for venous ulcer. If we are doing it here, okay, patient will be sitting in a size of the knee. Okay, will make them comfortable, and then according to the area of doing, we will make the body part more visible. Okay, by making we can't turn the patient like this, or the comfort position of the patient. Okay, so the patient should be made to sit comfortably on a stool of the height of the knee. placing his elbows on his knee. Okay, so the procedure, elbows in his knee. So otherwise patient will be because this procedure, as we discussed, patient should be very courageous. If the patient is like very tense, we can't do this procedure. The bleeding will be little more. Okay, the patient should be very comfortable. So placing his elbows on his knee and the feet together comfortably. Feet together in the floor comfortably. Okay, then the site of Siravedana and facing the sun like this on the floor. Okay, like this we will sit the patient. The site of the Siravedana should be selected according to the disease. If it is here, we will do here. Otherwise, if it is like in the swelling of the knee, we will be doing it here. So according to the patient's disease, we will be selecting the area.
Okay.
So that is also depending upon each. It will be variant to each patient. If we have 2 Siravedanam today, according to the patient condition, we will be selecting the areas. Then a tight bandage, either of moist cloth. Moist cloth, you know, right? Moist means wet cloth. So we will take a cloth, we'll wet it. We'll make them wet and we'll use as a bandage. Otherwise leather or inner bark of trees or something. We need something as a bandage. Then should be tied about the site of Siravedanam. Generally 5 centimeter above the site. Okay. So above the site of the Siravedanam, we will be make a tight bandage. Okay, so if it is your leg, okay, if this is the area I am doing, if this is the vein, this is the area I am doing, here I will be make a bandage tight. Okay,
As we used to draw.
yeah, draw normal blood. So if we are drawing from cubital vein, we will be tying here. Otherwise, if we are taking from here, we will be tying here. So general, it's like normal. That's why this actually like normal venous puncture. Venous puncture is doing in many countries, not in the Siravedan name.
Yeah.
Venous puncture is a common procedure nowadays. So then the physician should raise the vein. Okay. Then if I am tying here, if I am doing it in this vein, I will tape it. Okay. Tape the vein on it with his middle finger, triggered by thumb. So this is the procedure. Like normal blood test also, like normal blood, yeah. So you know the procedure, right? Like this, we will taper the vein. Okay. So on finding that vein is palpable. So at that time, the vein will be more visible and palpable. He should hold the needle. So like we discussed the name Mandalagra Shastra for Prachana, right? For Prachana, nowadays we are using lancet. But in text, we are studying the name Mandalagra Shastra. I wrote before, right?
I cannot remember.
Instead of
yes,
Mandalagra
instrument.
Shastra, in
The
ancient time, they used.
Yeah.
That is the instrument name. For Siravedam, the instrument name was Kudarika. Instead of this, we are using needles. So this is the instrument name we use in ancient times.
Also ancient.
Huh?
Kudarika.
Mandalagra Shastram for Prachana.
It's ancient time. This is ancient time.
Kudarika for Siravedam. Got it?
Now
Now
it's just
lancet for Prachana, needles for Siravedam.
Okay.
Before Mandalagra Shastram for Prachana, Kudarika for Siravedam.
Okay.
So the same, according to all those instruments, nowadays we constructed all new instruments.
Yeah, of
Okay. So we will be using Kudarika with the right hand and keeping it with handle up. Like this we will keep it. We will not keep it like this on. Okay. We will be keeping like this. Okay. Then place it on the vein in the center. Okay. If we are doing it in this vein. Okay. I will be making it center. Okay. I will be make the needle tip on the center of the part. Okay. Then the center and puncture the vein. So do you know? So we will not puncture it like this.
No,
Okay.
slowly,
So we
slowly.
have J-shaped needles. So many kinds of needles is there. So J kind of needles means this shape. Okay. Otherwise not this much, this much. Okay. So if it is vein, we will place this area here and then tape its the vein tip. We will tape like this. So at that time it will puncture them.
Oh.
So we don't need to puncture like in lancet. With lancet we are doing puncture. Don't do like that also. Just keep it there and then in the tip we can do a small like this. So at that time the needle will puncture the vein. That is the procedure. So puncturing the vein. Okay, that's why it's called puncturing the vein. Okay,
Yeah.
we made a puncture in the center of the vein. Okay, then at places where the vein is hidden and the skin is thin, pressing with thumb should be done. So if after tying the vein will be more visible, at the time we will make the needle like this, puncture, so the vein the needle puncture. Otherwise if the vein is not visible, if it is too thick, otherwise if we have two muscles, so at that time we will squeeze it with the thumb. Okay, we will squeeze so we will squeeze the veins like this with the thumb, then we will place the needle and then puncture. Like the injection, if you have aware of doing injection, it's easy, the same procedure. Like this. So if we do this, so if we have therapist assistant, they will be doing this. Okay, so then doctors will make this here and then will puncture. Okay, procedure done. Then so the sizes of pricking, okay, where then like size of puncture in muscular areas. If you are doing it in a muscular area, like in calf muscle, if you are doing, that is a muscular area. So puncturing should be in the sizes of barley grain. Okay, so you can write that. If you are doing it in muscular area, otherwise you can write a heading, size of puncture.
It's too detailed for us, I think. Huh? Too much details for us.
That you don't need to, you just need to listen, otherwise you don't need to. Procedure I can tell. Okay, the puncture is done, right? So at that time they need to collect the blood. Okay, so at that time if it is a like very less strength patient, the maximum limit is 100 ml. Okay, 100 yeah. Then if it is a moderate strength patient, if not strength of the patient, also strength of the disease, if the toxins is very less, we will collect like 100 ml like that.
Yeah.
Okay, the strength of the patient and also strength of the disease. If it is like moderate, we will be taking like 200 ml. Okay, otherwise 150 to 200. Then otherwise if it is a strong patient and also strong vitiation, at the time we will take little more than 200. Okay, so 100, maximum 200 and above, and then in between 150 to 200. Okay, then normal limit times, just learn it. Okay, you don't need to study much more about this. The physician should allow a part of vitiated recta to remain inside the body. In Jaluga Vajarnam, we will not allow the vitiated blood to stay there. We will rub with honey and everything, we will release it.
Okay.
Here, because we have sections, in Jaluga Vajarnam also sections is there, but here we are not draining too much, because if we rub too much with things, there will be chances of, because we are puncture it in vein, not in capillaries or skin. Okay, so inside the body rather than draining it excessively. Okay, because otherwise then for that vitiation we can do some other applications, then it will help to release that. Otherwise if we done like squeezing or anything, if we done, over bleeding will be happening, because we are doing this procedure in veins. So that is the limit you need to know. Okay, we will be doing the according to the concept, then over then like after 4 or 5 sections, if we are thinking okay still little bit bleeding is there, we will stay there. Okay, not after each section. After 4 or 5 sections I am telling, if you are thinking about little bit color, like that's why when we are doing in varicose veins, that full black discoloration will not be going with all the sections, but we will have that protrusion will be less, the discoloration, vitiated blood will be releasing, but little bit blood is there. If you are thinking like that, we will stay there and we will be giving any other external application. Okay, then just you learn about the Samyak Lakshana, Adiyoga Lakshana and Ayoga Lakshana. Okay. Means how we will know this procedure is over or the procedure it's finished. Okay, so Samyak, if we are doing it properly, we will be feeling Laghava. Laghava means lightness.
Samyak.
So Samyak Lakshana you will write. So the procedure done. So how we will know? So Samyak Lakshana. Okay, Laghava, lightness of body or site of puncture. We will not feel that heaviness.
Okay.
If it is properly done, site of puncture. Then reduction in pain. So while releasing the blood, at that time we will be having a pain. So the reduction in pain means this is done properly. Then third one, subsidence of severity of disease. So these are the 4 Samyak Lakshana, good signs. Okay, like now good signs, signs of good venous puncture.
Microchip? Is that you? Should I come?
In the Balagram, I'll inform Aruna. I'll inform Aruna. She will.
Okay. So this is not the sign we will get after a section. Okay, we will not wait for these signs after a section. We will take maximum 100 to 150 ml in a section. Then we will inform the patient to go back. Then we will be coming for the next section. So till we feel all these symptoms, we will continue the treatment.
But after they lose so much blood, will they fainting if they have low blood?
So at that time we need to be, so that's why we will take maximum 100 to 150 ml.
Maybe for the low blood patient, even 100 or 102 will be a lot for them, right?
For failing also we will be giving managements like IV and everything, we will be having managements. This will not be doing for a patient who is going home. So if the patient is under our supervision we can do, otherwise the managements we will be advising, and also in the preparatory period we will be doing the blood test and everything. If it is an anemia patient, we will not plan this treatment. Okay, so she is asking whether the patient will be get faint. There may be a chance. That's
No
why.
blood, no
So
blood.
Low blood
yeah.
pressure.
So that's why while preparing the patient, we need to check their vitals, confirm the patient is strong and courageous. With the vitals also, preparing the patient, make the patient strong means the patient shouldn't be strong like big size in the terms of vitals. Like blood test, as per blood test, his HB should be like normal, his BP should be normal, pulse, saturation, everything should be normal. Then only we will do this procedure. If the patient is weak on the day of treatment, even though he is a strong build patient, we can't do this. Okay.
Obesity cannot do this.
Obesity, no restrictions like that. For obese patients, there is venous ulcers. We done this. But obese patient, if he is strong, he need to be strong in the terms of vitals. Then we can do this. Okay. So till we feel this signs, we will continue the sections. So for some patient, within 4 sections, they will be feeling this kind of signs in the varicose pain, varicose ulcers, maybe protrusion with pains will be there. So after they feel like painless, in the reduction in the pain, we will be continuing. For some patient, according to their chronicity, we will continue this treatment for 2 months with like a very weak sections. So 8 sections. For some patient, if it is acute complaint, we are doing this planning this treatment in the beginning period, within 4 sections they will be getting relief. So this is the Samyak Lakshana. Okay, signs of good result. Okay, then you just learn Hina Yoga. If it is not bleeded properly, okay, when as we discussed, when we are doing it in winter season, it will not bleed properly. Otherwise, if we are doing it in a rainy season with cloudy time, it will not bleed properly. Okay, so at that time, if the puncture is improper, otherwise if it is a cloudy day, or if the patient is affected with cold or breeze, there will be no proper bleeding. So at that time, we will be doing sudation, the steam. If we don't have that much bleeding, we can do steam. So at that time the area will be little bit heat. Then if we puncture, we will be getting proper. So there is the way to do Hina Yoga, sudation, sweating therapy. Then if done after meals, then the vitiated Rakta does not flow out as much required. So immediately after that treatment, without resting for 48 minutes, if the patient is coming, there will be no proper flow. Okay. So in person suffering from fainting, exertion or any other kind of discomforts also, we will avoid this treatment, because if we done this treatment in that climates and everything, we will be getting less flow. Okay. Then at that time, we will be applying the Rakta Pravartaka herbs over that area. We will make the bleeding release. Same concepts. Okay. So in some climates, if it is cold climate or cold condition, if there is no much heat in the body, less bleeding. So at that time, we need to use Rakta Pravartaka herbs.
I think it's enough.
It's finished, right?
Finished. Our mind is smoking.
Okay, then fine.
Smoking.
So on the procedure is finished. I am just telling the Paschat Karma also. Proper massage and dressing after the procedure. Okay. So whenever blood stop, okay, we will be giving a massage, small massage, just to make the body, that otherwise that body part will be too much irritated after the puncture. After blood test also, they will be giving a cotton just to give this kind of massage. So that kind of massage we will be doing, and do a deep bandage.
Oh, you mean doing a massage immediately?
Not oil massage. Just in the needle site area, we will be doing a massage like
the same.
Yeah, like the same. Then tight dressing is needed.
It's like it's really similar like the normal drawing blood.
Yeah, normal rub. Otherwise, if there is stagnant, if we didn't done this, lot of vitiated blood again will come there and will be ecchymosis. Do you know ecchymosis? No. Accumulation of discolorated blood. So there will be, if we didn't done this, after injections also, if we didn't done that massage, there will be a bluish or blackish color. So to avoid that, just a massage and dressing. Finish.
Oh, okay. So next class will be
Vasti.
Vasti.
Yeah.
Nice.
And also you can remember, after doing all these treatments, the patient's body will be weak, but they can't eat very heavy meals. Okay? They need to eat. So after all this treatment, Rakta vitiated means Pitta is also less. So their digestive power will be weak. So they can eat very easily digestible foods like kanji, okay, porridge, soup or anything.
Will be the red light.